Hey, I'm Morgan.
And I'm Madison, and we did my grandfather for the home health visit.
Okay, so when we went into his home, we conducted a safety check, and he has throw rugs, outdoor stairs. He lives in a rural location, so he's kind of a far distance from any kind of healthcare field or hospitals or anything. Um, he has a small bathroom, so it makes it really easy for him to trip when he's getting in and out of the shower or just getting up off the toilet. He doesn't have any side rails. He has some sharp edges on the fireplace, and he doesn't have a house phone. So he only has a cell phone. So if he were to fall and didn't have a cell phone with him, he'd be in some trouble. So we explained to him to remove some of these throw rugs to decrease any risk of falling. Um, Educated on being careful with the stairs and how to add side rails to help. He did have good lighting. He didn't have any cords. He has a one-story home. His house is really clean with no clutter, and it's in a good condition. So overall, he was in good condition, but we did educate him on the few things that were wrong to help benefit his safety.
And as for his medicines, he takes a few different medicines, and the first one being ipratropium bromide once a day by nebulizer for his COPD, and he knows how to take it. He demonstrated it to me how he does it, so he knows what to take, when to take it, and what to take it for. And he takes aspirin once a day, and asked him what it was for, and he said blood thinner, so he knew what it was for. Ibuprofen if he has any pain in his joints as needed. He takes metformin twice a day, once in the morning, once at night. It's a tablet. He told me when he took it and what he took it for. The same for gabapentin. He takes that for his neuropathy. He has pain in his feet. So he takes that twice a day, once in the morning, once at night. Lisinopril once a day for his hypertension, and hydroxyzine once a day for itching. He knew why he took all the medicines he took and when he took them. He knew everything. He goes to the doctor, so he knew how to take all of his medicines and what to take them for. So I really didn't have to educate him on those.
Okay, and so Madison's grandpa, he has COPD, diabetes type 2, and hypertension. And so to manage his condition, we talked about a change in diet, which he kind of works on, still kind of struggles with because he really likes his church's chicken. He does smoke, so we talked to him about smoking cessation and the importance that that has towards his high blood pressure and really everything that's going on, diabetes. Um, but he hasn't quit yet. He doesn't have hearing aids because he probably could use them. He's kind of hard of hearing. Um, but he does wear his glasses, so he helps that with his vision. He attends regular checkups, which is good. He goes to a doctor quite regularly. He does have good compliance and adherence with his medications. Like Madison just said, he knows everything about his meds. He takes them on a daily basis and does good with those. And he stays active, and he monitors his O2 sat because he has a monitor at home and he checks that daily.
So some community resources is we asked him what he does, and he goes to his normal physician's office for his checkups and for his diabetes, COPD management, and just for physical checkups. And there's a hospital, Citizens Baptist Medical Center, which is in Talladega, so it's only like 20 minutes away. So he goes there if he needs to go to the ER or anything, or call there to go there. And then some other places we saw was a Talladega Health and Rehab, and it's just for anyone that needs short-term rehab and patient education. They have classes to teach the people about like disorders and how to manage their disorders. And then also there was an urgent care and a citizen's home health. So if he ever gets worse or has a COPD exacerbation, thank you, then he can have the home health come to his home.
Yes. And he also has close family nearby, so
yes.
that did help with his community resources.
Right down the road.
Yes. And so his available resources for managing his health condition, like I said, he has an O2 sat monitor, so that's good. He checks his blood glucose and has the resources to do so. He has a good stock on everything. He said that he actually just went to the doctor today, and he got some more supplies for that. And he also knows the healthy range that the doctor told him that the doctor liked for him to stay between, which was 120 to 140. And he also has a rescue inhaler. Some things that he could probably use is a blood pressure monitor, because he doesn't have that, so he can't really keep up with his blood pressure and his hypertension. But yeah, I think that was like the only thing that he really could use that he doesn't have.
So. He is not a caregiver for anyone. He lives by himself. He's a widow, so he just lives by himself. But well, his brother lives down the road, or right, it's his neighbor, so that's good. But he's also doesn't require any care at home. He takes care of himself. He's pretty independent. He does everything on his own. He does all his yard work. He's pretty active. So yeah, I'm not concerned. We're not concerned about that. And the only thing is, it's about 20 minutes away from the hospital where he lives, so that's the only concern. But it's still not too far, and he has family right down the road, so that's good.
Yes. Okay, so for education about his conditions, like I said, he has COPD, diabetes type 2, and hypertension. We basically just did like a discussion. He would input, and then we would input about the disease. And so with COPD, the points we covered were that it was air trapping and causes a barrel chest because the alveoli become damaged and flaccid from emphysema, and airways become inflamed and irritated from bronchitis. And those symptoms can lead to like a shortness of breath, fatigue, and like more susceptibility to infection. And so we discussed that. And then for diabetes type 2, we discussed back and forth. He would contribute, we would contribute, just that it occurs because insulin receptors are resistant and insulin is unable to be used by the body to bring down his blood glucose levels. And so his blood sugar needs to be managed by exercise, diet, and medication. And that there's an increased risk for infection. He has poor wound healing, and to monitor your feet, and that neuropathy can occur. And then with hypertension, we discussed that it was because of a prolonged high blood pressure above 140/90. And to help with that, you can limit your caffeine intake. So his sodas and coffee, which he likes a lot of coffee. So that was good to inform. Smoking cessation, again, he hasn't gotten there yet, but he knows. And medications. And so it can also, if you don't manage your hypertension, that it can lead to major problems such as a stroke, MI, and kidney failure.
And so we explained about each disease, and just like we just said about smoking cessation and how it contributes to all of his problems. I have told him many, many, many times, other than this time. That's his biggest thing, that it's hard for him to quit. And then diet change, lose some weight, to take his medications, which he knows to do that. Proper foot care. He takes care of his feet. He knows about his feet. He even told me, his doctor was like, yeah, if you have any surgery on your foot, they'll have to end up cutting it off or something. And I told him to wear his shoes, don't go barefoot, take care of his shoes, be careful when he cuts his toenails, and then also to know of any signs and symptoms of a COPD exacerbation or a hypertensive crisis or a stroke or MI, which is a headache, a bad headache, shortness of breath, chest or arm pain, racing heart, know to call if his O2 sat gets too low, and know a healthy range for his blood sugar, which he does. and know that if his blood sugar is too high to exercise and too low to drink orange juice or eat a candy bar. And that's what he told me. So he knows a lot about his disorders and he really takes care of himself. So thank you so much.
Bye.
Bye.